Hello. So my name is Pavel. I'm the CEO of company Health Samurai, and today I want to speak about our platform, development platform for modern web and mobile healthcare applications called 8box. The platform is built on top of a centralized file server, fast healthcare interoperability resources, the name of the standard. So there are several, I can start, right? There are several companies right now offering different development platforms for healthcare. Some of these platforms help with HIPAA compliance. Some of these platforms help with integration with EHR systems. But still, the cost of development for healthcare is very high. So why is it very high? Why does it take that much time, even for best engineers, to develop for healthcare? Well, in addition to regulatory compliance and significant burden associated with this, and necessity to integrate with legacy EHRs, healthcare has a significant domain complexity and has no tolerance for errors. So, Health Samurai development platform 8box addresses not only HIPAA compliance issues and integration issues, but it also addresses the complexity problem. Essentially, we build our platform on top of a production-grade file server called 8box, and what we suggest, instead of creating your own custom, very often inefficient when one company does it, data models, we suggest open, free, open source documentation, file specification online, and learn what best industry experts designed through the years and how they suggest to store medical data. So we offer this storage for medical data compliant with FHIR data model and SDKs for different technologies such as Java, .NET, Swift, JavaScript, etc. To develop your applications. When you develop applications this way, you not only save time and money and do it better, but you also develop applications which you can ultimately deploy into healthcare IT marketplaces of the future. And when I'm saying the future is pretty much now. Epic, Cerner, Vista VA, Athena Health, they have already supported FHIR API. And other HR vendors, because of state streaming for use, it has requirement to have OSC certified API for every HR. They also developing and catching up. So, so that's basically technology which already existing. If you develop like one application for healthcare, you can win from it. But if you are a large enterprise-sized company, you probably have several applications. And if you build your applications on top of a centralized, standardized backend, you can get interoperability out of the box for all your applications. They will work with each other, even if they are developed by geographically located teams located geographically in different areas of the world. So what you can do with 8box, with our FHIR platform, you can use it as a backend. You can develop different HR systems, care coordination systems, patient engagement systems. You can build HIEs. You can use our platform as an integration bus. You can build powerful data analytics tools. You can take solid data from solid data sources from different areas of healthcare organization and put them into a centralized data storage and build powerful data analytics. And if you have if you already have built an application which has proprietary backend, but you want to bring FHIR applications or SmartFHIR applications into your platform, you also can connect your backend with standardized backend offered by our platform and bring all these beautiful applications built by different companies which use Fire API into your ecosystem. So Health Samurai has been working on Fire solutions since 2012. Have a lot of significant customers who benefited from Fire technologies. A lot of stuff already went into production. I know when people speak about Fire, in many cases they think about only one use case, that Fire is an API for EHR, like you expose data in Fire format. Well, Fire is much more, and I suggest like educate yourself about Fire and apply it in other areas, not just like things that I can consume data which will be exposed through Fire API. You can use it in many more other production like quality applications. That's it.
Thank you so much for that. So the question that I have for you is, are your clients concerned about vendor lock-in?
Yeah, great question, thank you. Whenever you develop something and you choose a development platform, vendor lock-in is a great concern. Like I start development, how I'm gonna, like if my vendor fails me, like or decides to charge me like 10 times more, what I'm gonna do? Well, that's probably the most open platforms that have less vendor locks than anybody else, is that based on the standard, right? I mean, you are not satisfied with your vendor, you don't like what I offer, okay, you choose another Fire server. They are supposed to be 100% compatible. There is a project Argonaut where they test all these Fire servers. So you take data from my Fire server, put it into another Fire server, and keep working without any changes in the code base at all. So I think that's the beauty of standards, like the least vendor lock you can find anywhere in the industry.
Thank you.
Thank you very much.
So this is my presentation in reverse, okay? And now lightning will happen twice, once forward, once reverse. Okay, so here it is forward. Again, I love starting with the title, and this is my title, and that's probably what drew you here. But what I'm going to emphasize today is what I emphasize with the students in my program. The students in my program are engineers who want to work with doctors, and doctors who want to work with engineers who, while studying either for their PhD in engineering or for their MD as doctors, they're participating in teams to build devices and more software. And so this is what sort of pulled me into this area. For those of you who heard my talk last year, this looks awfully familiar, except I've changed some of the text, because as I teach my students, I'm learning more and more. And part of what I'm doing is trying to have the students develop a mindset and a collaborative mindset. And I love the fact that our representative from Humana is an improv person, because the improvisational mindset required to, really let down your guard and understand other perspectives. So this is a graphic that tries to capture that way of teaching empathy, because the variable, and part of what I came up, why I'm presenting on this topic, I'm from Boston sometimes, is that I have been to countless sessions where how many of you have purchased or have received a wearable device? Everyone puts up their hand. And how many of you are actually using it now? One or two out of 20, right? And so, and that's the question. What happens to this? What's the potential? And the short answer, I think, has to be the missing link. Namely, how is that information collected and used in a meaningful way? We have to focus in a values-based provision of and design for devices. That's the leading question. that, what is the problem that needs to be fixed, what is the pain that needs to be alleviated, what is the potential gain from these devices. And that needs necessarily to tie in bundles of different information. And I've coached many teams, and in this way, I'm more a lightning. I'm picturing myself as Zeus, or I have lots of lightning teams under my umbrella. And I just want to also give a little bit of a shout out to HTF, because HTF is one of the organizations through whom I've been able to open up the doors to our university, University of Southern California, to invite other people in to do pitches, to interact with my students, etc., so my students can relate. So I think what's missing, and part of what anyone recognize the photo on the right? Anyway, anyone? The Prisoner, right? Like, why don't they make TV shows like that? These are TV shows I remember watching that as a very young kid and going to sleep and having dreams that would sort of keep me thinking for days, right? And in this series, only 17 episodes long, by the way. The common refrain, I am not a number, I am a human being, right? So this is the underlying fear. Like, if you use numbers, you quantify yourself, it will really be, it opens up a bunch of different sort of fears in a Pandora box of fears that isn't necessarily music like the other Pandora box. And I think we're going to have mid-level apps that are going to try to orchestrate all this data. And so what we need to do is really sort of step back and think about what do we need to do on a policy level, on a philosophical level about how to organize this information. Otherwise, we're going to be just sort of hit back and forth by fears. And this question about Bill Gates, Stephen Hawking, Elon Musk, basically they're all telling us we should really be afraid of the coming robot apocalypse, essentially. So is that necessarily true? If we redo things now, I don't think that that's true. And we can all get paranoid together, or we can also search and work toward the common good. So here's a perspective that's really important. I think you're going to, you've heard it already. You should hear more and more about it. It's a P4 medicine. So, predictive, personalized, preventive, and participatory. And for this talk, I only have, you're going to put it up right now, one, right? Yeah, so one. So I really have to get back to the last part, which is participatory, okay? You have to, and this was discussed, it's not have to, by the way, it's really, we're at an inflection point in time where people have the capability of being very actively involved in their healthcare and can bring in other people, and it is a community where you need to understand different pieces and fit them together so that you can make decisions in your healthcare and participate in decisions and include people in making decisions that are very different than the kind of decisions one made 100 years ago. Let's sort of leave it at that, because I think I'm into the negative time zone at this point. And any of you who have questions, please. Oh, the other thing too, if you want to do participate in events in the LA area, please contact me, and I'll help you get that done too.
So George, I do have a question for you, and the question is, what's the most important skill that your students need to develop to become better in their business?
Okay, that skill is not an unfamiliar question, because I got to pose it, by the way. Empathy is the key skill, and part of what is important with empathy is to get people into places where they're uncomfortable with how they're reacting and with whom they're reacting, so they can actually learn how to think differently and appreciate the perspective of another person, another way of living, another society, another culture. And it begins with these two cultures, medicine and engineering, but it will inevitably involve other cultures too. Like right now, one of the things that people want to learn about is this whole sort of business culture of lean approach to startup companies and what's that about. So and that's another sort of layer that I'm offering students as well. So thank you very much. Thank you for the opportunity to talk.
Thank you. So, big problem we face in all of our offices with patients is communication. And there's often a big divide between what we tell patients and what they walk away with. And there are a lot of reasons that patients don't understand, and we'll go through those, but when patients do understand, they're more likely to acknowledge their healthcare problems, they understand their treatment options, and they modify their behavior or comply with medication or treatment schedules and achieve better health outcomes. And that's really what we're after here when we see a patient. But the problem is patients don't recall and sometimes and frequently don't understand, and there are a number of reasons for that. One is we all have a normal memory decline. 90 million Americans are considered health illiterate. We use complex medical terminology unknowingly, even some simple words that we think are simple, our patients have never heard before. We overload them with information. These can be very emotionally charged discussions, especially in my office when I tell you I'm about to cut your head open and rip your skull cap off. Organic disease, dementia, Alzheimer's, and some of the treatment that we give patients. Pain medicine, chemotherapy, radiation, those all affect their cognition. And patients have a poor insight into their lack of understanding. They're overconfident, and 1 in 5 patients actually recognize that. And the corollary between the physician's perception of patients' understanding and the actual understanding is very disparate, as you can see on the scatter plot. And I pick on the orthopedic surgeons. 3 out of 4 think they communicated well, but only 1 out of 5 actually agreed with those physicians. It's probably a bigger divide than that. There's implications of the poorly informed patient. Non-compliance, costing our healthcare system almost $300 billion. Dissatisfaction, #1 complaint in a recent Consumer Reports article. 34% of all patients who are Medicare population are readmitted within 90 days, and that's right in the crosshairs of CMS for penalties. Poor health outcomes, litigation, malpractice when the patient's poorly communicated to, and unnecessary expense, which is really is contributed to by all those things above. And we see patients in our office all the time. They're screaming out to us that we're not communicating them well, and they can't remember. Why? Because they come in with tons of Google research. They show up in my ICU with their own camera, video camera, their iPhone. They take notes. They bring in family members. I'm in Arizona. We have a lot of snowbirds. Elderly people will have their child at their side who flew in from New York just for the doctor's visit. And if that's the only purpose, it's a really inefficient way. My journey really began with my own father. He was a PhD in economics from the University of Chicago. My mother's a nurse on my left. I ran the Chicago Marathon in his honor. He passed away 6 years ago this Wednesday. And despite my mother's healthcare background and my father, who was highly educated, every time he went to his oncologist after he was diagnosed with prostate cancer, the inevitable phone call to the son was, "What did the doctor say?" And it was clear to me that their level of understanding was only about this deep. And when I, dug a little further, and I inevitably had to call his doctor and say, "Can you re-explain to me what's really going on here?" And that's really inefficient as well. So when I went back to my own clinics in Arizona, I thought, boy, it would really be nice to have a recording of all my dad's visits. And that's been suggested since 1977, by the way. They just bring an audio recorder and put it on tape. And we started out with some Best Buy cameras and evolved in this tablet-based, low-cost system. So we use it in the office to record the visits. We use it at discharge for instructions. We use it when we're rounding. I frequently make rounds in the hospital. There's no family there. They feel uninformed. We use it in the waiting room, discussions after surgery, for example. And it's a really simple concept. They check in, they get a little information, they register on the tablet. There's a low-cost tablet in every doctor's room, so nobody has to move them in or out. All I have to do is walk in, hit record, and it uploads to the cloud in a secure mobile platform. I also use the tablet to show them their images or show them models. A video is worth 100,000 words kind of thing. They get an email within 5 minutes and they can rewatch the visit. They can watch it as many times as they want. They can share it with whoever they want in a secure, HIPAA-compliant, cloud-based platform. And we started this in 2008. Went to the CEO of my hospital. She was taken aback, a little worried. She said, "Why don't you do it in your office for a while?" I said, "Great, I'll be the guinea pig." Because I think it's the right thing to do. And I heard a lot of this from our Humana expert next door. You know, this is what I would want for my own father, and I'm a doctor. So why would I give it to all my patients? Because I'm a doctor, but I'm also a son, and I'm a father as well. So in an N of 300, we did some surveys. Patients were watching their videos 2 to 5 times. It answered every one of their questions 75% of the time. Reduced phone calls in our office by 25%. We can put a calculus on that. You can save $40,000 a year if you're looking for a financial ROI. They shared their data 75% of the time, or planned to share it. They shared it with friends, families, other trusted healthcare providers. And they felt that their trust equity was increased when their doctor says up front, "I'm going to record you." 97% of them felt it was a good idea. And the testimonials are, as you'd expect, memory, I was overwhelmed, etc. And we also know video telemedicine is on the rise, so we need to figure out ways in the age of personalized medicine to personalize our communication for these patients. So I welcome you to Arizona. Come visit the Grand Canyon, and thank you for your time.
I do actually have a follow-up question for you, and the question is, do you think that video recording increases the legal risk to you as a provider?
Yeah, that's the number one question we get from my colleagues when I sit in the lunchroom and suggest they might consider this. And I try to tell them, I use myself as a guinea pig. I've been doing it since 2008. We have over 10,000 videos. We haven't actually had a single lawsuit that involves the video. It'll only be a matter of time. When we have 100,000, I'm sure we'll have it. But our thesis is that it's going to be more protective than harmful. It's kind of like the Safe Driver program. People that are practicing good medicine have no problem being reported on that. And the lawsuits usually end up in it. He said, she said, right? And from a provider's perspective, I give the same spiel. I have about 40 spiels, but I'm giving them over and over. From a patient, it's a unique event for them, usually overwhelming emotionally. So it's natural for them to sort of forget some of those conversations if that's your concern.
Thank you.
All right, so I'm going to take a little bit of a different twist here. You guys have all been in a Walmart, would be my guess. Anyone not been in a Walmart? It's a nice look for a company that at least everyone knows about. All right, so here's the deal. When we take a look at a lot of the problems that are facing healthcare, whether it's engagement, whether it's cost, and a variety of the issues that we've heard about over the last couple of days, the bottom line is we're here to see if we can make a difference. This is not working. All right, if you look at the bottom here, our goal is to lower healthcare, lower the cost of healthcare with increased customer value and access. The idea here is real simple. You can't do that without technology. Now, with that in mind, let's think all the things that healthcare payers are doing. We heard a little bit of it earlier today, but you want to engage your members, your patients, whatever you want to call them, our customers. We'll talk a little bit about that in a few minutes. But the idea is there's some things that we do really, really well. We can buy things really inexpensively. We're really efficient. When it comes to doing common things over and over again at a really good cost, that's what Walmart does. If you want a one-off thing, forget it. We'll never get it right. But the idea is we can help healthcare when it comes to that. You need technology to do it for all the reasons that we've heard today. People forget what they're told. You have to interact with folks. They have to have and understand what is going on. Those are the issues that come up. Now, when it comes to Walmart, this slide actually turned out better than I think, or than I thought. The idea is we have a lot of healthcare assets, and we're out there in the community. We've got about, based on a press release that came out earlier last week, 60% of America is in and out of our stores on a monthly basis, and about 140 million people every week walk through our doors. That means that you have access to the folks you want to have access to. In addition to that, you can connect to them relatively easily. Now, this is just a list of some of the healthcare assets that we have. And we have pharmacy, and we're the third largest retail chain, and we have Vision, and we're the largest provider of glasses in the United States, and do a variety of those things. But we also have clinics that we're starting up. We've got about 200 and some odd of them, about 19 that we own, and the rest are contracted out. We have grocery. This is, how many of you want to get your members eating healthier? How many of you want to get folks to start doing what's appropriate in a daily basis? Take a look at the wearables. We have wearables probably for less money than anyone else does on a retail basis. And there's a number of health plans around the country that come to us and say, can you buy me 100,000 wearables and I'll have people pick them up at your store? And the answer is yeah, we'll do it. Breast pumps, that's a program we're doing right now for 1.2 million Medicaid members in one of the Midwestern states. They run about 35,000, 38,000 pregnancies a year, and they want to get breast pumps. They're going to teach these mothers how to go back to work, and we're going to do interviews for them, hopefully hire a few. But the idea is let's make it an easy activity. Let's give the information out to the members that need it. And then let's use this information and give it back to the health plans so we can get an idea of what are these people's lifestyles like, what are they doing on a daily basis, and how can we impact their health care so that hopefully they get engaged with their health system. They have some type of communication other than I have an emergency and I have to deal with it retrospectively. Because as we all know, that is not the most cost-effective nor effective way to get long-term improved health in the United States. Anyway, you can see some of the rest of this. We've got our money centers, which is actually kind of a unique thing. Look at it that for Medicaid expansions, where this has got a huge amount of interest from some of the national players, but we've got the ability to collect premiums there. We also have the ability to reward folks or provide the rewards that you want provided as a health plan payer or sponsor to your membership. And it's all things that can be done. One of the tools that we have, maybe this is semi-related to technology, and for a retailer, we don't talk about our technology. But this is something, we call it 3D, we're lousy at naming things, but the idea is if you're a health plan payer and an employer, doesn't matter, a state healthcare system, we don't really care what, we can take and deliver rewards that you want your members to have in a way that gets down to the SKU, shelf keeping unit. I can go to Red Vitamins on Tuesday on the third shelf, 4 over from the left, for an hour if you want. The idea is we can not only deliver that to your members, so prenatal is part of what we do here, we can do it for wearables, we can do it for PrEP, which is fruits and vegetables or a healthy line of food that we have all great for you, which are healthier alternatives to dry goods, less salt, better wheats in terms of what's in the noodles and stuff for hamburger out there. But the idea is the member can come in, they can do their shopping. They can go online, check the website and find out what is covered by their plan and what is not, just by putting in their member number on the back of the card. Now, they'll go through and they go into checkout, and what they do is the same thing you would do whenever you check out, is just swipe your card, your rewards card first. And we have a number of different vendors, so if you're with DC or Incom or First Aid or whoever does your administrative, those rewards programs, we can talk to a number of them. The idea is we will tell the member what they saved on what product, and you can collect that information back as a health plan or a payer and know what your members are doing. Consumer information, find out what they're doing on a daily basis, get this information back, and we'll show it to the member on the receipt so that they'll know exactly what they got a discount from. How much money the health plan saved, and then it was printed on the bottom and it says your health plan saved you X today. That's member engagement, and that's one of the things that we're doing. And with that, I think that's my last slide, and thank you for your time.
So, I have a question for you, Michael. And the question is, can you explain why Walmart is the partner of choice in these efforts?
All right, so the reason Walmart is the partner of choice in these efforts are that, as I stated earlier, we've got 140 million Americans going through our doors every week. I've got about 150,000 different products available in every one of my stores, and I've got about 10 times that available on Walmart.com. The idea is whatever healthcare you want to deliver, if it's a retail-based type of activity or retail-based type of delivery, we can handle it probably better and more efficiently than anyone else at a lower cost to the payer. In addition to that, I got 5,400 pharmacies across the country, about 5,600 facilities, and we're building about another 96 this year. We're definitely, when it comes to rural areas, probably your best access partner. Much better in suburban than we have been in the past with the neighborhood market franchise, and we're actually going into urban right now. We've got 8 stores in Washington, D.C., and we've got 60 in Chicago, as well as other major cities. So that
As you heard, my name is Shauna. Thank you so much for having me here today. So the next 6 minutes, I'm going to be telling you about extreme environments. But first, before we start, I'm going to start with a question. What do the International Space Station, a remote village in Uganda, the Antarctic, and the Aquarius Reef Research Base 60 feet under the ocean off the coast of Florida have in common? Yeah, I kind of gave away the first slide, so the suspense was gone, but that's exactly right. They're all examples of extreme environments in areas where extreme environment medicine can be practiced. And this is something I know a little bit about. As you heard, I'm the life sciences team lead of Astronauts for Hire. I'm also training as a suborbital scientist and citizen scientist astronaut with Project Possum and Phenom to go up in suborbital flight, as well as with Project Poseidon to spend about 100 days under the sea at Aquarius Reef Base, also finishing my residency in general practice. So this is where medicine and space all come together. So what is the definition of an extreme environment and medicine? How does that all tie together? Basically, as long as it's difficult to access. So difficult to access geographically, limited in terms of the resources it has, and then constrained in terms of budget, finances, mass volume storage. That's what defines an extreme medicine environment. The good thing about this is that all these constraints make us think outside the box when it comes to developing solutions, whether we're talking about remote Uganda, whether we're talking about the ISS. It makes for a breeding ground that is rife for innovation and solution development. So if you don't believe me, I'm going to take you through some examples of technologies that have been developed for space flight that have actually been spun off for healthcare here on Earth. So starting in the top right here, this is a microbial valve check water purifier. It was initially made for the ISS, but because it uses an iodine resin to purify water, because it's so portable and lightweight, it's now been spun off to be brought as a water purifier to remote locations. In the next panel in the middle on the top there, you see an example of a handheld ultrasound scanner, again developed for imaging on the ISS, now being used in Arctic communities for pregnancy well checks and injury scans up in the Inuit population in Canada, where I'm from. And the list goes on. Going through the list just rapidly, insulation used on every space mission has been spun off for lightweight thermal blankets, reflecting 97% of the heat. The ISS uses a battery-less, solar-powered air conditioning system, which is perfect for the 1.5 billion people on this planet who live in communities that don't have electricity, that still need medication, still need vaccinations, that need to be refrigerated. So the applications there are fairly important. In the middle panel on the bottom, you see an example, you see a bunch of fresh food, but the application there is the air scrubber that keeps the water or the air clean and fresh on the ISS is being used to remove chemicals that accelerate decay for foods here on Earth, increasing transportation time, increasing our ability to store these foods, decreasing food wastage, and lastly, you see an example of a portable inflatable communication system that can be set up in remote environments and disaster regions. So I hope to have convinced you that there is a lot of overlap between these remote environments, whether it's in space, under the sea, whether it's here in a remote village on Earth. And the implications, the ideas that drive solutions are the same as well. It comes down to 4 key questions. It comes down to probability. How likely are we to run into event X? And if that event happens, how much of a risk is it? You know, is it an inconvenience? Is it loss of limb, loss of life, loss of mission? And how much will our solution mitigate that risk? And how simple is it to use? You know, is it press the button and go and we have a solution? Or, you know, when we need to use our proposed technology solution, we get stuck at step 17B of 64-step chain of command. And then what are our constraints? Are we constrained by mass, volume, access, financial, budgetary constraints? So those are the drivers, and we've talked a little bit about opportunities for the developing world, but I want to spend some time talking about opportunities for the developed world, as well as spin-ins. So on the image you see here is one of the partners, and also from that first slide, we did testing with a company called Final Frontier Design did some spacesuit testing in microgravity, and they're now developing a compression stocking that we use during aerobatic flight to keep us from passing out when we experience high G-forces. They are looking to partner and commercialize this for patients who experience orthostatic hypotension. Spin-ins, I won't spend too much time on that, but as space missions become increasingly complex and increasingly ambitious, there are a lot of problems we need to solve. So we're here today to talk about the common good. So my ask to you is, let's collaborate. I have access to parabolic flights, Mars simulation stations, Aquarius Reef Base, through my various affiliations and partnerships with the projects I mentioned, Project Phenom, Possum, Poseidon, Astronauts for Hire, and Final Frontier Design. My mandate with Astronauts for Hire is to assemble teams to develop technology research and payloads, and further our science and our knowledge in spaceflight. But while we're at it, why not address the common good? So thank you very much for your time.
Thanks so much, Shona. So the question that I have for you is, if someone does want to partner with you, what are some of the opportunities for collaboration?
Yeah, for sure. So that's a great question. So I talked mostly about the garment that Final Frontier has. They're looking to commercialize. And then what you see on the bottom here in the middle panel from the left, second panel from the left, is another lower body negative pressure suit that has kind of been gifted to us by its developer that we're looking to test. So if you have any interest in partnering on that. And then any technology you want tested. This is, I think it's Vitrios. This was a technology, a biosensor that was developed and flown in zero-G before I came on as team lead. If you have anything that you want to fly in zero-G, or if you think that needs to be tested in a remote environment, please come talk to me. I would love to partner with you. Thank you so much.
Thank you.
All right, before I get started, I'd like everybody to look to your right, and then look to your left. And this isn't business school, so I'm not going to tell you that a few years from now you won't be sitting here for graduation. But what I will tell you is that it's highly likely that one of you is pre-diabetic. So currently there are 86 million Americans with prediabetes. That's 1 out of 3. And if you think about the impact, right now 29 million Americans have diabetes. And if 86 million people become diabetic, which would be likely in the next 10 years, it's a tsunami that will cripple the healthcare system. And every day, thousands of patients go to their doctor, and the doctor says, eat better and exercise more. And then they send you out into a world where that's not very easy. And so what we're looking at is a solution that can impact the ability for people to make healthy lifestyle changes that's affordable, efficient, easy, and effective. So the Centers for Disease Control established a program called the National Diabetes Prevention Program based on a National Institutes of Health study back in 2002 that showed that through a 12-month lifestyle change program, it reduced the incidence of type 2 diabetes among those at high risk, 58% of those younger than 60, and actually 71% of those greater than 60, older than 60. And it actually had significantly better outcomes than metformin. Today there are thousands of community organizations and digital program providers that have built the capacity to deliver the diabetes prevention program. These are places like a church, a YMCA, a federally qualified health center, a Department of Health, and then increasingly dozens of digital providers who've realized there's a huge opportunity to scale this to the 86 million people in need. But the issue here is these are not traditional healthcare providers. They're typically non-credentialed, non-clinical providers in communities. And there's both an opportunity here because as you think about chronic disease prevention and the hyper-local need for a trusted resource that can address not only cultural competence but linguistic specificity in communities, it's a huge opportunity. But as if you think about a Y or a church or a Department of Health, they're not a traditional healthcare organization. They don't know compliance, they don't pull any EMR data, they don't really know a lot about what it takes to integrate with a health plan or physicians, but they do really, really good job around delivering programs. And I think that when a lot of times the medical profession talks about community, they think about ambulatory care and home care. They don't think about the health ministries in a church. They don't think about Walmart. They don't think about the YMCA down the road. And there's a missing opportunity, I think, as an adjunct to primary care. And this is why Solera was born. So the opportunity is to connect people at risk to a network of programs and link patients and payers and health plans with those patients at greatest need, and handle all of the messiness, right? All of the compliance and the reimbursement and the operations, because I don't think that's the expectation we should have of these organizations doing really great work. So Solera is a preventative health network that connects patients, payers, and physicians with a new class of healthcare providers simply and securely. We have established a high-access, low-cost integrated network as an adjunct to primary care. And so a lot of times people go, oh, well, you're a network, you're just sort of matching people up. And I think when we developed this, it was much more than just matching people up. That's a really big part of what we do, making sure we identify the member and match them with that program where they're most likely to be successful. Because the experience at a Weight Watchers or a YMCA or a digital app or a text messaging app is very different and again, needs to be relatable to that particular patient. But what we do is 100% of our revenue comes from health plans. 100% of my revenue comes from submitting medical claims to health plans on behalf of a non-credentialed, non-clinical network. And so what we do is we partner with the health plan. We go to the doctor and say, doctor, you're too busy, right? You're managing these high acuity, high cost patients. Give us all your EMR data and we will engage your patients on your letterhead, right? So Dr. Jones is sending you this email or a letter or however we can engage with patients to say Dr. Jones is referring you into this program and you have a wide variety of options for you. And then what we do is all pay per performance. I hate PMPM because somebody's always upside down, right? So we only get paid if our network does a really good job of continuing to engage patients and actually deliver the outcomes of the program, which is, at this point, is weight loss and minutes of physical activity. Then we submit a claim to the health plan that we pay the community organization. So now we've established a sustainable revenue model for a church, for a Y, or for a digital partner who does not have the ability to integrate with healthcare, and typically in the community organizations have relied on grant funding. We have all the reporting, we use all of the community organizations use our technology at no charge, and then, again, we continue to establish the network. What's been interesting for me is when we started gaining our first health plan contracts, I thought, wow, as long as we have a digital option, community doesn't matter so much. And what I found is community is really important. Folks in health plans and doctors want the ability for their patients to choose between a community organization and a digital provider. And frankly, half of our patients or members still choose community, even when they have the option for a wide variety of digital partners. So again, we eliminate the complexity from the health plan because we are the single point of contract and contact on behalf of a very, very large network of hundreds of these organizations. And the interesting thing that we've also found as we look at launching Medicaid in a couple of states is I was able to go back to the health plan and say, our thesis is that if we can address housing, transportation, and, I'm way over, housing, transportation, and other things that we can actually improve health. So I apologize, we've got a lot of things going on, but we'll have 56 million members covered by the end of this year, and we're here to improve health. So sorry I ran over it.
Thank you so much very much. Before you leave, though, I do have a question. Why is now a good time for Solera to exist?
I think because physicians are overwhelmed, and especially as we migrate to value-based care, we're asking care coordinators to do too much. So if you think about prevention, and even the folks with one or more chronic conditions that are the low and rising risk, they are more than happy to have a trusted resource take on that work as an adjunct to primary care. And the other thing is I think members want choice. You can gain trust with people when you allow them to choose. So if they can pick among a really wide variety of organizations to help them in their health, patients have unique needs and preferences that need to be addressed by unique needs and solutions, including those folks in the community that can address social determinants. So thank you very much.
Thank you again. So we actually have a few more minutes to entertain questions of our speakers. So if anyone has a question, please let me know and I can hand you the mic. And then you can just identify which speaker you want to address your question.
Gentleman from Walmart. Speaker from Walmart.
Ms. Michael Jacobs?
So question for the Walmart approach to have a retail-based approach to engage patients. Do you see a opportunity for Walmart to actually play a role in the entire ecosystem of reducing readmissions and revisits?
Do we see a role for reducing readmissions? I'm going to say yes. Do I need to? Okay. I'm going to say yes. We do have we can play a role in reducing readmissions, and I'll tell you where. I've got about 14,000 pharmacists that work for us. We have about 268 clinical pharmacists that each cover about 15, 20 pharmacists. With that in mind, we work with, and I'll use Humana as the example just because they were speaking a little bit earlier, to improve their STARS ratings, and we work the direction of them as well as others cooperatively to integrate all of their pharmacy data, whether these people come to our stores or not. We do consulting, we have the and the outcomes, to all the different reporting tools. Right now, we're incorporating that into workflow so that we can, manage the compliance and do outreach on the apps, send a message or, but when you get into the store, if you haven't had your refill filled, you can just touch the app and get your refill. So in that sense, probably yes. The other thing is, we call it the store of the future. We're building clinical consulting areas. At the moment, they're where the pharmacies are and where the clinics are. So we have nurse practitioners in there, we have telehealth capabilities in all the clinics to get to your primary care physician with medical directors of the health plans for the patients. But in that sense, yeah, we can help a little bit. Is it the be-all and end-all? No, not at this point. We do have, and we partner with D-Life, is actually the one that we'd be more than willing to talk to, about having diabetes education programs in our stores. We have 7 programs going right now with one of the payers. So there's things we can contribute to.
Yeah, I was thinking more in lines of customizing the content for patient care from a pharmacy perspective, because what is prescribed is based on a ailment or a diagnosis. So you could easily provide that in your app or instead of rolling out another app. That's what is the equation from that.
In terms of information for the patient?
Information for patient, like physicians today, they use systems to customize information for patient. Now, when the patient uses the Walmart app to order a prescription refill, that would be a source of information for them.
It can be if it's linked in, and I'd be more than happy to talk to you about it. I'm not sure what we're doing